Ontario's key pandemic advisor, the bureaucratic doctor responsible for the implementation of vaccine passports that decimated our healthcare sector and ruined people's lives, has a conflict of interest with pharma oligarch and main COVID injectable manufacturer Pfizer. But why can't anyone in the Ministry of Health ascertain whether or not they know about it? Tamara Ugolini here with Rebel News, providing you with an update on my continued investigation on Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, who has a declared conflict of interest with main COVID injection manufacturer, Pfizer. My reports began several months ago when I discovered that Dr. Moore was part of a presentation hosted by the University of Toronto titled Changing the Way That We Work, where he provided information to family doctors on the role that they play in ensuring uptake of the COVID injections. In that video, Dr. Moore himself declares that he has a conflict of interest as he sits on the advisory board for Pfizer's Lyme disease North American strategy. Have a listen for yourself.
Have an honoraria from the Ontario College, and I'm on the advisory board of Pfizer for their Lyme disease North American strategy.
Before Moore's appointment to Ontario's Chief Medical Officer of Health, he was the local medical officer of health for Kingston, Frontenac, Lennox, and Addington Health Unit. Prior to the pandemic, he was hoping that this jurisdiction would be the testing ground for a Lyme disease vaccine, but I have confirmed with Pfizer Canada that this did not come to fruition. They're testing it instead in the United States. Let's not forget, too, that Dr. Kieran Moore received a 30% raise in 2020 during record unemployment, job loss, and small business closures for us plebs, with an astronomical yearly earning $412,637. It appears that his Chief Medical Officer of Health salary is a bit more modest, yet still, in 2021, he netted nearly $226,000. And in this role, of which he was appointed in June of 2021, he was the key advisor to the Doug Ford allegedly conservative government in implementing indiscriminate vaccine mandates, including vaccine passports that saw mass segregation of the unclean or the unvaccinated from society.
This morning, Ontario launched its own vaccine certificate. As of today, Ontarians will need to provide proof of vaccination before entering certain high-risk indoor settings, including restaurants, bars, casinos, theaters, and gyms. These settings were chosen based on the advice of the Chief Medical Officer of Health.
The great unwashed could no longer enter public venues, from their children's own sporting events to restaurants and cinemas, could not be by the bedside of their ailing family members during times of distress in hospitals, and many were terminated from their jobs without the ability to receive financial social supports that they have paid into their entire tax-paying lives, what we refer to in Canada as employment insurance, or EI.
Employers in a wide range of sectors are starting to lay off employees for refusing to get vaccinated. Will individuals who lose a job for refusing to get vaccinated qualify for employment insurance?
That's a very important question, and we're looking into it. My current thinking on it is that's a choice, and of course, not counting medical exemptions or valid reasons for not having the vaccination. But if you choose to leave your job for that reason, my current thinking and the current advice I'm getting is you won't qualify for EI.
It is a stain that no doubt will haunt Ontarians and Canada as a whole for years to come. And since these initial reports, I have filed 3 separate access to information requests to try to find out whether or not this conflict of interest by Dr. Kieran Moore was declared before he became the main advisor on vaccine mandates. Each of those have their own costs, which you can help to offset by donating to help me in this research and investigation at rebelinvestigates.com. At that website, you can also find all of my previous reports on this subject, because each one has specific little nuances that are relevant to the bigger picture, such as the fact that Moore should have technically disclosed this massively unethical conflict of interest with Pfizer to his Deputy Minister of Health, that's Dr. Catherine Zahn. Oddly, it's not an independent review board such as the Ontario Integrity Commissioner. No, apparently Dr. Moore would have to declare this to the Deputy Minister in his own ministry. So that's strange in and of itself, but I've reached out to her, Dr. Catherine Zahn, numerous times, and she doesn't answer my requests. To note here that Dr. Catherine Zahn made an astronomical $650,454 in 2021, which was down from her pandemic bonus of almost $705,000 a year salary in 2020. Why would this taxpayer-funded bureaucrat have to answer to little old me? Initially, I was also reaching out to Christine Elliott's office because she was at the time the Minister of Health, but she also doesn't return my calls. For reference, she was making a mediocre $165,000 a year salary. I even asked Doug Ford, Premier of Ontario, if he knew about this conflict before he appointed Dr. Moore. Have a listen. Mr. Ford, do you know that Kieran Moore has financial ties with Pfizer and he sits on one of their advisory boards?
Sorry, we're going. Thanks.
Mr. Ford, were you aware of that when you appointed Kieran Moore? Would you have appointed Kieran Moore if you knew that he was direct ties with Pfizer?
Guys, he's done taking questions.
This past June, after the Ontario provincial elections that saw then Minister of Health Elliott bow down from re-election, the new Deputy Premier and Minister of Health is now former Ontario Solicitor General Sylvia Jones. Her salary as Solicitor General was also a mediocre $165,000. I emailed her and a few other ministry contacts listed here that are in charge of communications and operations on August 17th asking. I have been trying to get a hold of Deputy Minister Zahn for months, inquiring about a conflict of interest declaration that should have been made to her by Chief Medical Officer of Health, Dr. Kieran Moore. Before I feature an update on this investigation, I would like to clarify the following. First, does Dr. Moore have declared conflicts of interest filed with the ministry? If so, does it include his declared conflict as a Pfizer advisory board member? 2, do you manage and/or disclose the financial amounts associated with conflicts of interest? And if so, what is the total financial amount associated with Dr. Moore's Pfizer membership? Third, granted that this conflict was disclosed, how has the ministry rationalized Dr. Moore's advice on vaccine passports with his ties as a Pfizer advisory board member? And lastly, if this conflict was not disclosed, will that be investigated, and if so, by whom? At the time of this report, no one has responded to my request for clarification. Surprise, surprise. Because I'm not having any luck with the access to information requests either. The ones that I have put in with the Ontario Ministry, just worded slightly differently to try to gain access, have come back as being denied in full. They cite the following reason. Conflict of interest declarations submitted by or for Dr. Kieran Moore as part of the vetting process related to obtaining his current position of Chief Medical Officer of Health are HR, that's Human Resources records, and are withheld in full subject to the exclusionary provision of FIPPA, the Freedom of Information Privacy Protection Act, Section 65, Bracket 6, Bracket Labor Relations. Section 65, Bracket 6 that are specific to labor relations read. Subject to subsection 7, this act does not apply to records collected, prepared, maintained, or used by or on behalf of an institution in relation to any of the following. 1. Proceedings or anticipated proceedings before a court, tribunal, or other entity relating to labor relations or to the employment of a person by the institution. Second, negotiations or anticipated negotiations relating to labor relations or to the employment of a person by the institution between the institution and a person, bargaining agent, or party to a proceeding or an anticipated proceeding. And third, meetings, consultations, discussions, or communications about labor relations or employment-related matters in which the institution has an interest. Basically, they're withholding this human resources record, such as the employment contract, but I don't care about Moore's employment contract. I want to know if he had a declared conflict of interest with Pfizer. That's it. How can a public servant have private conflicts of interest? Needless to say, we're appealing this decision, and I plan to keep digging. To support this important work, to highlight the hypocrisy of the bureaucracy, please chip in to offset the costs of my work at rebelinvestigates.com. For Rebel News, I'm Tamara Ugolini. Rebelinvestigates.com is a special website that features all of our exclusive reports and primarily access to information requests. To support this kind of investigative journalism and ensure that I can continue bringing you stories just like this, please support my work by donating there and visiting the website to see all of our other important investigations. That website again is rebelinvestigates.com.